Hi everybody, Dr. Mike here. We're going to take a look at the parts of the heart. So some of the anatomy associated with the heart. Now the first thing I want to look at is the layers of the heart. So if we were to take a quick snapshot, looking through the various layers of the heart, there's three major layers you need to be aware of. Let's start from the inside and go out. The most internal layer of the heart we term the endo, which means inside, cardium, referring to heart. This layer is lining the hollow chambers of the heart and is actually continuous with all the valves of the heart, which we'll talk about shortly. The next layer, which is the thickest layer of the heart, is actually called the myocardium, and myo as a prefix actually means muscle. So this is that cardiac muscle. This is what contracts in order for the heart to generate that force to pump the blood out. And then the last layer, the most external layer, is what we call the pericardium, and it's actually a pericardial sac which covers or encases the entire heart. And there's actually two layers of the pericardium. The layer that's closest to the heart is called the visceral pericardium, because visceral means organ, and the layer further away is the serous pericardium. Okay? All right. What the pericardium does is it produces a fluid called a serous fluid, and it simply lubricates the heart because as a muscle, it contracts and moves. And when it does this, it generates force and friction, and we want to minimize this friction because it can cause injury. And that's what the pericardial sac does. Next thing I want to look at are the various chambers of the heart. So here is a more complex drawing of the heart, but we can really simply just draw up the type of heart you'd see in a cartoon, for example, right? And what you can do is you can just break it up like this, and now we've got four chambers. Two up the top. Now the two up the top are called atria. That's plural, and atrium is singular, so just one. And the two down the bottom are called ventricles. And obviously you've got left atria, left ventricle, right atria, right ventricle. We're always referring to the patient. So I'm standing like this. So this is left, this is right. Always remember that. That's really important. So obviously this is going to be left, right, left, right. Okay, that's the first thing. Two atria at the top, two ventricles down the bottom. Next thing is that blood always enters atria, always. So you're going to have blood, let's start here. You're going to have blood entering the right atrium. And blood will always flow from atria to ventricles. Now it needs to go through a space, right? It can't just move through a wall. So there's a space here, and this space needs to have little flaps that open up and close, open up and close. And that's what we call a valve, because valves are one way. And there has to be one way. We don't want this blood going up and regurgitating back. Now on the right-hand side of the heart, which we're looking at here, right, left, this has three valves. And it's called the tricuspid. Tri meaning three, cuspid referring to the fact it looks like little cusps, right? Okay, that blood then goes into the right ventricle, and the right ventricle is going to pump the blood out. So blood always leaves ventricles. Now that's the right-hand side. Let's have a look at the left-hand side. Blood's going to enter the left atrium. Once it's in, it's going to pass through some valves. But on the left-hand side, there's only two valves. And so we call it the bicuspid. Tricuspid on this side, bicuspid on the other side. It's also known as the mitral valve. So we can write bicuspid, and we can also do mitral. Then the blood flows into the left ventricle, and the left ventricle is going to eject that blood. Now you can also see I've drawn these in different colors because the right-hand side of the heart deals with blood that has less oxygen, and the left-hand side of the heart deals with blood that has more oxygen. And the way you can think about it is like this. Blood that's entering the heart that has little oxygen or less oxygen must be coming back from the tissues of the body, right? Because it's just delivered that oxygen. So this is coming from the body. And what does it want? It wants oxygen. So we need to deliver that blood to something. So it goes back to the heart so it can generate more force. And then that heart contracts, and where's it going to get that oxygen from? It's going to get it from the lungs. Now, once that blood's gone to the lungs and picked up that oxygen, it needs to go back to the heart. So this side is now dealing with blood that has more oxygen, oxygenated blood, and it's coming back from the lungs, going into the left atria through the bicuspid valve, into the left ventricle, and out. And where's it going to go? To the body. Deliver that oxygen, and it's back again. And so this is a nice, simple way to begin your journey of blood flow through the heart and the various anatomical features. We can translate that to a more complex picture of the heart. And what you can see again is right atrium, right ventricle, left atrium, left ventricle. The blood comes back from the body, not through one area, but two, what we call the vena cava. And you're going to have an inferior vena cava and a superior vena cava. And this is blood coming in back from the body. And it goes back to the right atrium. Then it goes through that tricuspid valve, which you can see here, into the right ventricle. It will contract and blood will be ejected out. Now we know it's going to the lungs, right? It's going to the lungs. And we've got two lungs either side of the heart. So obviously this blood vessel needs to split to go to the left and right lung. But before it does that, it needs to go through another valve. And that valve we call a semilunar valve. And it's what we call the pulmonary semilunar valve, because pulmonary is referring to lungs. Then it goes up into this trunk. So we call it the pulmonary trunk because it looks like a trunk and trunks branch. And it branches to the right and left pulmonary arteries. Important point here. Arteries always leave, right? Arteries always leave the heart and veins always return. Return to the heart. So once it's gone to the lungs, it's got that oxygen. It then needs to go back to the left-hand side. So what we've got here are veins, because they're going back to the heart, from the lungs, so they're going to be called pulmonary veins. And they're going back in, and they go to the left atrium, through the bicuspid valve, into the left ventricle, and then that left ventricle will contract and eject blood out of an artery, which we have here, called the aorta. But again, there's a semilunar valve, which is called the aortic semilunar valve, that it must move through. When it moves up through here, this is called the aortic arch, delivers it up to the head and neck, and then down to the rest of the body. And again, this is the aorta. So this is a very quick run through of the important parts of the cardiac system.